So this is the gambling disorder specifiers. As with substance use disorder, there's 4 specifiers. There's specifiers, and I'm just including this because maybe not everybody knows what a specifier is, but it's some additional information that can further aid in making a diagnosis, and we want to include that in our assessment and document it. Remission, this is the same with substance use disorder. There's only 2 categories of remission: early, which is 3 months to 12 months, or sustained, which is greater than 12 months in the DSM-5, as compared to the DSM-4, which had a plethora of choices. It could be early partial remission, partial full remission, early partial, for all kinds of different language like that. But in the DSM-5, it's early or sustained. And the severity level, now this is a little bit different from the substance use disorder, which started at 2 or more. So it's on the continuum from mild to moderate to severe based on a symptom count. So this is a numbers game. If you want to, don't be afraid to count it if you're giving a diagnosis, to get the numbers where they need to be for the approval for the recommended level of treatment that you're going to ask for or recommend for the patient. So it's really just a symptom count where one, tolerance or bailing out might seem a little more severe than problems in their relationships. It's just a numbers game. You're going to count the symptoms to get to the level that will coincide with the level of care that you're recommending. There's 2 more specifiers of the 4. So episodic or persistent. So this is a little bit different. Episodic, I'll let you read that. And persistent. So it can be either one, and you would identify that. A person could be having problems with gambling, not every day, but they're doing it, they're gambling a lot over a period of months. Or persistent. So I'm just going to give you the coding for gambling disorder. It's gambling disorder, mild, moderate, severe, based on the symptom count. And this is the DSM-5 and the ICD-10 diagnostic code. Now, for those of you that are familiar with the substance use disorder codes, the 4th character designates the severity level, 1 or 2. And then there's other numbers afterwards for co-occurring or substance-induced mental health disorders. But with gambling disorders, there's just the 1 code. And then you are going to specify in your documentation the symptom count, whether it's mild, moderate, or severe, but it's just F63.0. I just included some other codes there, so you could see what was in that bracket of codes, because rather than with substances where we're at F10, F11, F12, F13, we're at F63 here. This is F63.1, pyromania. This is hair pulling and kleptomania. So there's just the 1 code for gambling disorder. And you'll specify mild, moderate to severe in your documentation.